Dr. Walter is a doctor in private practice. He is losing money every day without even realizing it, due to improper billing. First he tried to do the billing, then he hired staff, but he is still working harder and earning less. Medicare rules and health fund guidelines are getting more complicated day by day. Dr. Walter's staff received billing training from the previous staff and is aware that he is not following the guidelines properly. Not only is Dr. Walter working harder, but he is earning less. Billing difficulties are putting him in danger and making him lose his ability to bill Medicare and health funds altogether. Not only is Dr. Walter losing money, his staff are frustrated with the billing. If only he could find a better way to do his medical billing. The good news is he can. With CareMB, Dr. Walter can focus on his practice, and since we are the experts, we can take care of his billing and collections needs. Most of our clients can see an average income increase by allowing us to perform their medical billing. We have recovered hundreds of thousands of dollars for doctors all across America. With medical billing experts like us, not only did Dr. Walter increase his income with proper billing, we can also help him recover lost income by performing billing audits and cleaning up old billing. Now he can earn more money while his workload and practice becomes easier to manage. As the time demands of EHR data entry, the average physician spends 30% to 50% of a patient encounter looking directly at the EHR. CareMB will help providers in setting up of new EHR system, and merge old EHR data by coordinating existing and new EHR system, enabling necessary options to meet meaningful use of EHR system. Almost all EHR system will have secure data exchange options. The growing number of uncompensated tasks. As much as 20% of the workday is spent grinding through tasks such as prior authorizations, error data entry and non-clinical paperwork. This busy-work costs physicians at least $50,000 in lost revenue annually. CareMB will identify doctors' painful areas and tasks which takes more time to resolve, like EHR data entry and non-clinical paperwork, etc. So CareMB will cover all billing-related works within the accepted percentage, 4%. Doctors will be relieved from maximum time-taking work and concentrate on their patient care. Third-party payer interference in patient care. No prior auth medications. Create list which trigger for prior authorization in EHR or paper by payer-wise. If provider check the list before prescribing, many prior auth will be avoided. Loop in the staff. Keep staff engaged, and they need to inform provider about the test medication which requires prior auth. To identify the difficult payers. Work with payers. Need to create rapport with the payer staff and examine the approval and denials. Share the criteria. Keep the list of payer prior auth. Additional info request. Assign staff to handle this payer to handle smoothly and for faster approval. CareMB will prepare a list of major CPT codes which require pre-authorization based on the specialty and payer. Will coordinate with doctor office staff at the time of patient appointment on daily basis to prepare prior medical records to get authorization if necessary. Managing quality measure incentives disincentives. MIPS. 50% in quality, 25% in advancing care information, 15% cost and 10% in clinical improvement activities. From 2018, CMS will calculate cost through Medicare spending per beneficiary, MSPB, and total per capita cost measures for 2018 carryovers from the value modifier program. Provider has to focus the areas to improve with the quality. CareMB will help our provider to meet quality measures based on provider specialty. We would submit claims along with PQRS codes to gain quality score, and also will help our provider to enable advancing care information and improvement activity in their EHR system. Remaining independent in a time of value-based care initiatives. The rising cost of compliance with government reporting and changing reimbursement models has forced many doctors to either join larger physician groups or sell their practice to a hospital. Change the pricing model by contracting directly with patients or via primary care provider. CareMB will help and guide the provider to increase the revenue by suggesting to perform eligible new type of service using provider specialty related equipments by analyzing the yearly reports. As well, we can suggest the provider attend medical certification to enhance his practice efficiency. The rapidly changing reimbursement landscape. Many provider already participating in incentive program. In addition, the provider has to extend hours to see patient can count towards quality metrics. Provider has to attend the webinars from CMS and can ask question affecting their specific practice. Provider has to adapt and change for value-based care. CareMB will help providers to increase MACRA scoring rate high by adhering to MACRA guidelines. The ever-changing healthcare insurance marketplace. Physicians or groups with $90,000 or less in Medicare Part B charges or 200 or fewer Part B patients will not be required to participate in quality metric reporting. CareMB will help our provider on upcoming medical updates related to adhere the MACRA implementation, facility updates related to provider specialty, alert in penalty, deleted CPT and ICD codes, decrease in Medicare fee schedule on regular and yearly update.